Hi everyone, welcome to the channel. In this video, I'm going to talk through how to become a physiotherapist. So I'm going to do two things. I'm going to talk through what is physiotherapy and what are the kind of areas you'll find physiotherapists working in. And then towards the end, I'm going to talk about routes to qualifying. So how do you actually become a qualified physiotherapist? I thought it'd be helpful just to start with a bit of that big picture definition of what is physiotherapy. So, this definition comes from the Chartered Society of Physiotherapy. They're also called the CSP, and they're pretty much the go to people if you're thinking about physiotherapy. So, they define physiotherapy as helping restore movement and function when someone is affected by injury, illness, or disability. And physios do that in a few different ways, but predominantly we do it through movement and exercise, we do it through manual therapy, and we do a lot of education and advice as well. So what do physios actually do? So there are probably four main kind of big picture areas that we work in. The first area is neurological. So that might be with a patient who's had a stroke, they've got multiple sclerosis, they've got Parkinson's disease, so anything to do with the neurology of the body. The second area you'll find physios working in is what's called musculoskeletal, and that's also called neuromusculoskeletal sometimes. And so this is probably the most common area of physiotherapy that people think about. So that's working with people who might have back pain, neck pain, knee pain, arthritis, sports injuries. It can be people who've got orthopedic problems. So maybe someone's fallen and fractured their hip, so they need physiotherapy to rehabilitate them from that. So that's the kind of musculoskeletal field. The third area is there's the cardiovascular. So that's working with people to rehabilitate them after they've had a heart attack or they might have heart disease. So it's about getting their function as good as possible. And then the fourth area is respiratory. So that might be working with people who've got chronic obstructive pulmonary disease, so kind of difficulty with their breathing. It might be someone who's got cystic fibrosis, so kind of everything to do with the lungs. So this looks like four kind of neat boxes that people fit into. But the reality is actually you need to draw on all of those skills probably a lot of the time to be working as a physiotherapist. So let me give you an example. You might be working on a ward and you have a patient that comes in and they've had a stroke. So that's the neurological system. So they've got weakness down one side of the body. So your goal is to get them moving and functioning as well as they possibly can. But while they're in the hospital, because they're not moving as much, maybe they go on to develop a chest infection. So actually, then you need to draw on your respiratory skills. But the person might have a history of having a heart attack. So you need to be aware about the cardiovascular system as well. And very often people go on to develop things like knee pain or back pain. So that same person might also be struggling because they have a long-term problem with their back. So in that sense, as a physiotherapist, you need to draw on all of those skills to help that person have the best possible quality of life. We actually work in a really broad range of areas. And from my perspective, this is one of the best things about being a physiotherapist because there's so much variety. You're not going to get bored from physiotherapy. So I just wanted to touch on some of the other different areas that physios work in. So I've spoken a little bit about, neurology, respiratory, musculoskeletal, orthopedics, but you'll also find physiotherapists working in pediatrics. So that's working with children because children also have problems with all of those same systems that we've just been talking through. You might find physiotherapists working on oncology, so that's to do with cancer or end of life care. You could also find physios working in learning disabilities, helping people move and function as best as they possibly can in that area. You'll find physiotherapists who work in the community. And actually, this is one of my favorite areas of physiotherapy because sometimes people are too poorly to come into hospital to see a physiotherapist. So the physiotherapist needs to go to them and see them in their own home. And that's great because you can actually see firsthand then some of the challenges that that person may be living with on a day-to-day basis and provide really individual, personalized care for that person. So that's really tailored rehabilitation. You'll find physios who work in elderly care, and physios could be working in mental health. You'll find physios who work in amputee rehabilitation, women's health, men's health, burns and plastics. Like basically, there are lots and lots of different areas you'll find physiotherapists working in. So if you think physio is what you want to do, check out some of these areas in a little bit more detail because I think you'll be really pleasantly surprised at the variety and breadth of the career. I also wanted to touch on a little bit about where physios are based because I think people tend to think traditionally of physios like just being in an acute hospital or maybe in an outpatient setting, but there's actually a whole broad range of places where we are based as well. So if I start off with the acute hospitals, yes, you will find physiotherapists working on the ward. You'll also find physiotherapists working in intensive care, and I think that's an area people aren't always aware of. So if you imagine you've got a patient and they're in intensive care and the machine is having to do the breathing for them, actually there's always a risk that they can get phlegm on their lungs, so the secretions get really stuck. So it's the role of the physiotherapist to try and help keep that person's chest as clear as possible, to help rehabilitate them. I've touched on physiotherapists working in outpatient departments. You'll also find physiotherapists working in accident and emergency, so in the emergency department. So it might be that when someone presents at the emergency department, actually it's a really acute musculoskeletal problem, maybe a really acute back pain, and so it's more appropriate that they see a physiotherapist rather than a nurse or a doctor in that context. As I mentioned already, you'll find physiotherapists working in community trusts, so that could be home visits, that could be in GP practices, that could be in special schools doing paediatric physiotherapy. You'll find physios working in private practice, so that could be sports injuries, it could be dance companies. So if you think about professional dancers who are working at that really high competitive level, they're really at risk of injury, so you can have physiotherapists who work with them in quite an intense way. If you're someone who loves animals, you could go on to be a physiotherapist doing animal therapy. You'll find physios working in industry, trying to make sure people don't end up with injuries in those areas. You'll also find physios working in the charity sector. So I spent about 10 years working internationally as a physiotherapist. So that calls on a whole different range of skill sets as part of your profession. And you'll also find physiotherapists working in hospices. So I've put this slide up just to kind of give you a bit of a flavour of all the different locations where you could find physios working. So this next slide is really thinking about the attributes that you need to be a physiotherapist. So if you apply to a university, that university will be looking and checking your qualifications to make sure you've got the academic ability to succeed on the course. But universities are also really interested in you as a person and making sure that you've got the attributes and the values that are required. And the reason that's important is because the National Health Service does what's called values-based recruitment. So as part of their interview processes, they're looking to make sure that they are recruiting people with the right values. So what I've got here is not an exhaustive list, but I've just put a few things that I think are probably really important traits to be looking out for as a physiotherapist. So it's so important that as physios you have really excellent communication skills and that you like people. You know, being a people person, we work so much with people. It's a really important part of our role. Physio is also a really practical job, so being quite practical is an important attribute to have. It's important as a physio to be flexible, to be encouraging, to be empathetic, patient, caring. You know, imagine if you're a patient and you've broken your hip and you're in a lot of pain, it's been fixed and it's okay for you to get up, but actually you're really scared about doing that. You want to be treated by a physio who's actually quite caring and patient as part of that. Physios rarely work on their own, so it's really important to be a team player as a physiotherapist. And it's also really good to be proactive. You know, if you're someone who likes to get stuck in and give things a go and has a lot of initiative, they can be really great qualities to have. So if you're looking at this list and you're like, tick, 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 that really describes me, then physio could be a great career for you. But if you're looking at this list and you're like, not so sure I've got that many of those attributes, then maybe physio isn't the right career for you to be looking at. So I raise it as food for thought for you to be considering. I'm going to talk a little bit now about the 4 pillars of physiotherapy practice. So this is what the Chartered Society of Physiotherapy, the CSP, talk about as being important for the entire workforce. So anyone who's a physiotherapist needs to be aware of and really working with these 4 pillars. So the clinical one is probably the most obvious, isn't it? So you think about working with patients, so you need those clinical skills. But actually, research is also really important because when you're working with patients, you want to draw on the best available evidence to make sure that you're providing the best possible treatment plans for your patients. And you only know that if you're accessing the research evidence yourself so that you can determine the best interventions. So that's why research is also a really important part of clinical practice. And then there's education. So that might be, I don't know, maybe you're doing as part of your continuing professional development, some modules at a university to develop in a particular area, or it might actually just be that informal education that you do when you go to a lunchtime in-service training when a colleague is doing a teaching for you around a particular technique or something that's really important from their practice. Um, Education is also really important in terms of the fact that you might be working with student physiotherapists, so actually training them and educating them, or maybe there's a new therapy assistant that you're training up. So education is so integral to our role, and we spend a lot of time, educating our patients, and education is empowering, isn't it? It's a really important pillar to our practice. And then there's leadership. And sometimes I think newly qualified physios struggle with this because they just think, oh, I don't know that I know enough to be a leader yet. But actually, every time you're leading on handing over a patient, leading a handover for patients, or you're contributing to a multidisciplinary team meeting, you're actually showing your leadership skills. So it's important for all of your practice. So what I want to point out, if you're going to train to be a physiotherapist, what you need to be aware of is the placements that you have at university. Not all of those will be clinical. So it could be that you have a research placement where you're actually doing some research to develop our physiotherapy knowledge. It could be that you have an education placement, so you're actually working with your lecturers to develop a package of learning around something. It could be a leadership placement, so you're leading on a service development project or a service evaluation. So be prepared when you're studying physiotherapy to have a whole range of placements arranged around these pillars. The other thing I want to say about this is actually these different pillars might become more prominent at different stages in your career. So I definitely had my clinical pillar, which was really strong and really important and kind of was my day job. And yes, I needed all those other parts, but the clinical was kind of the pillar that stood highest. But then I went on to do a PhD. So actually research became the more prominent pillar when I was in that research season. I work in a university, I teach, I'm a lecturer. So actually education as that part of that pillar, that for me is also quite prominent. I've done a number of leadership roles, so whether that's clinically or research or education. So then when I'm in a leadership role, that kind of stands a little bit higher. And I'll say again, this to me is one of the best bits about physiotherapy because there is that variety. So actually, if you've had a season working clinically, but you think, oh, I saw this was a problem clinically, and I think I'd like to do some research to try and understand how we could make that better, then great. That's where your research pillar can really come to the fore. So again, just to say there's heaps of variety with these pillars, which I think is really important. I also wanted to make sure that you're aware that physiotherapist is a protected title. So you can't have just anyone saying they're a physiotherapist. To say that you're a physiotherapist, you need to have successfully completed a physiotherapy degree. And then you need to go on to register with what's called the Health and Care Professions Council, so the HCPC. So to practice as a physiotherapist, you have to be on their register. So I just wanted to say that to make sure you're all aware of it. I'm going to talk a little bit now about routes to qualifying because there are a number of ways that you can get into physiotherapy. So that could be through a first degree, it could be through a postgraduate route, or it could be an apprenticeship. So first up, thinking about a first degree. So this is what I did straight out of school at 18. I knew what I wanted to do. I wanted to be a physiotherapist. So I did a BSc Honours in Physiotherapy. And the BSc stands for Bachelor of Science. So that was a 3-year degree. And at the end of that, I qualified and I could successfully register as a physiotherapist. The first degree route, I think, takes about 4 years in Scotland. So just be aware that there is that slight difference. There is also the option of doing an integrated master's. So that takes 4 years. And that means some of your training will be at that slightly higher level of a master's level of learning. And it means you get more time to be consolidating your research and your leadership skills. So that's your first degree option route into physiotherapy. Your second option is if you've got a relevant degree already, and by relevant degree, I mean something like sport and exercise science, biology, biomedicine, and different universities will have different degrees that they will accept as part of that. So do check out the different individual websites for more information around that. But if you've got a relevant degree, then you can do an accelerated fast track route. So you could do a postgraduate, so it would be an MSc pre-registration physiotherapy. So that would be a 2-year course, not 3 years. And the reason it's 2 years is actually because you come with a lot of that foundational knowledge already. So that's why it can be accelerated. There's also an option to do a pre-registration doctorate. Now, this tends to be more common in America. I understand there are some universities in Scotland where you can do a pre-registration doctorate as well, and that means that kind of the first 2 years of that are quite similar to that MSc pre-registration in that you're developing all of your clinical skills, but then as part of that, you get to have that extended period doing a research project. So that's why when you qualify with that, it would be a pre-registration doctorate. Your third option, and this is available if you're working as a therapy assistant already in practice and your trust is willing to sponsor you, you could apply to an apprenticeship route in physiotherapy. And so that means your job would release you for, say, 1 day a week when you'd be working at university and studying towards that physiotherapy qualification. So that's an earn while you learn type approach, but you'd need to be working already as a therapy assistant for that. In terms of where you can get more information, please make sure you check out the Charter Society of Physiotherapy website because there's heaps of information on there about physiotherapy. The other place to look at is, as I've mentioned, the HCPC, so the Health and Care Professions Council, just to get a bit more understanding of what they do and how they can be supporting you. So thanks for watching. If you've got any requests or ideas, please feel free to comment in the section below. I'd love to hear those ideas. And if you've enjoyed what you've seen, then please feel free to subscribe. Thanks for watching.